I think we've always understood that what happens early in life is important. We've always understood that the love and responsive caretaking of caregivers is important to infants. What's exciting and different now is that we understand that at a level of scientific knowledge that's increasing by the year. We understand it at the level of brain development, of genetic expression, and also how it links to later health outcomes. So we have a growing appreciation that brains are built over time, that they're built from the bottom up, and that brain development occurs in the context of relationship. Before we can see things, the brain is being organized and genes are being expressed. So you take language, for example. It's tremendously important. The language that children are exposed to, that it's a rich environment, that they're talked to and responded to in a way that is sensitive and attuned. And all of that is preparing the brain, laying down the pathways that'll lead to healthy, robust language development. So when they begin to speak, much of the work has already been done. Another thing that's important about that period of 0 to 3 is it's the time of greatest opportunity. It's when the sensitive periods are create the most potential for healthy development, and also the potential to compromise development. And the relative strength or the relative vulnerability that gets wired in early is carried forward over time. So it's never too late to help kids. It's never too late to attend to their physical health or their emotional health or social well-being. But the earlier that we're able to identify risk, the more effective, the easier, the more economical the interventions and the course corrections are.
With so much happening in the early years with brain development, early child care providers and teachers have a great responsibility. There are more than 11 million children under the age of 5 in some type of child care arrangement reported by childcareaware.org. Yet, early care providers and preschool teachers struggle to make ends meet. The Bureau of Labor reports that the median pay for a child care worker is just $11.65 per hour, while the median pay for a preschool teacher is $30,520 annually, compared to a kindergarten teacher's salary of $59,420. 58% of child care workers in California are on at least one public assistance program, according to Hopkins. The average annual turnover rate for child care staff is 30% in the United States. With low wages, little funding, and high turnover rates, it is very difficult for early care providers to create rich learning environments and the continuity of care to build the relationships needed for optimal development. Working in early care and education can be a difficult but very rewarding experience. There are always hurdles to jump in the field of early childhood. The most current hurdle has been the global pandemic of COVID-19. Early care providers have been given more responsibility and expectations, and the nation is realizing how important child care and schools are to our infrastructure. As we begin rebuilding our child care resources, we have the opportunity to restructure a broken system. Let's put more funding into the field of early childhood so that we can build a workforce of highly qualified staff that provides high quality services to all children.